So you've been diagnosed with blepharitis. Blepharitis is really what's called a biofilm, and that's a collection of oils, skin cells, bacteria that kind of develop and build on the lid margin. Well, obviously your doctor wants you to get that off your eyelid. It's not really great. It's not good for dry eye. So there's two great ways to really kind of take care of that and maybe not remove it 100%, but really treat it in low amounts of blepharitis. One of those ways is actually using a lid wipe. So these are tea tree oil based, and it's very important not to use just any product. So I really recommend these Blephadex wipes. They seem to work great, and a lot of patients really report great results with them. And clinically, when I look in the exam chair, look at a patient's eyes and my slit lamp, things look really clear with this. So how do you use it though? So it can be used in the morning, can be used at night. Most of the time we prescribe it to use once daily. Sometimes bad blepharitis, we'll have the patient use it twice daily. So you actually just kind of remove it out of the packet, okay? And you can kind of just unfold it here, right? So it's kind of two-sided. So once you get it unfolded, right, you kind of get it to a normal size to handle. And you basically take the wipe with your fingertips and you kind of just scrub back and forth, okay, on that one eyelid. I recommend about 30 seconds of scrubbing. So kind of get back, and you're getting both the top and the bottom lid. Don't pry your eyes open, right? We don't want to rub your actual eye. It's just on the surface, just kind of lightly close, going back and forth. When you're done with that side, you can unfold it, or you can just flip it over and use the other side. Same thing, you want to kind of scrub for about 30 seconds. And after that, you don't need to do anything whatsoever. So you don't need to rinse it off or anything. Another great product that we have is something that's called Bleph Foam. So I like this product from Eyeeco. It's tea tree oil based again. Now, don't try to make your own home concoction. Highly concentrated tea tree oil can really damage your eye. This has been tested, been formulated just to use for the eyes. You can actually use it as a facial cleanser as well. So this product, it's actually what I personally use. So I generally like it in the shower. Some patients will use it as sink. So you take 2 pumps. So you actually kind of hold your fingers there, right? Take 2 pumps, and then you can kind of blot it back and forth between your forefinger, right, and your middle finger. Creates that nice foam, and you kind of close your eyes and you scrub back and forth for a good 30 seconds. Now, when you're in the shower, you want to kind of use it and let it sit there for about 1 minute to 2 minutes. And what that does do is help kind of break down that biofilm, all those oils, all that product. And that really does kind of help that a lot. And then after it's sat there for a while, get on the shower nozzle and you kind of close your eyelids and then you scrub back and forth, getting off the excess. So hopefully that description kind of makes sense. And I tell you what, blepharitis is one of the most common conditions, and these are a couple great ways to treat it.